When my brother was an 8-year-old in 1992, he was diagnosed with attention deficit disorder, or ADD. And our pediatrician suggested that he be placed on Ritalin, a stimulant used to treat ADD and attention deficit hyperactivity disorder, or ADHD. And now, at that time, out of all my mom's friends' kids, Ben was the only one she knew of that had been placed on a stimulant to treat his ADD, which now just kind of seems absurd because it seems commonplace. Since then, the use of stimulants to treat children with ADD and ADHD has become very controversial as these drugs have become more prevalent in our society. In an article in the Canadian Medical Association journal in November of 2001, said that studies across North America have shown that ADHD affects 3 to 5% of children aged 18 years or less, making it perhaps the most common psychiatric diagnosis in this age group. Another study by Richard Scheffler, PhD at UC Berkeley, showed that the use of drugs to treat ADHD worldwide nearly tripled from 1993 to 2003. And along with that, the countries in which drugs were used to treat ADHD went from 31 in 1993 to 55 in 2003. Now, growing up with Ben kind of gave me some insight into what it was like to be one of those 3 to 5% with ADD and those being treated with stimulants. Along with this, I've also shadowed pediatricians for over 75 hours and many times been in the room for medicine checkups on kids with stimulants and also been in the room for the initial diagnosis of ADD. There are many reasons why people are for or against using stimulants to treat ADHD. And today I'll try to give you the major argument from each side. Those that are for stimulants will tout the effectiveness of the drugs, which can't really be questioned. And those against will warn you about the lack of physician oversight that often comes along with these drugs. Put simply, stimulants are effective in treating ADHD. In the multimodal treatment study of children with ADHD, or MTA, 600 elementary kids ages 7 to 9 were studied over a period of 14 months and then even beyond that. And the results were first published in 1999. This study showed that kids with medicine, treated with medicine, generally showed more improvement than those with behavioral therapy alone. And along with this, the medicines were also shown to help their social skills by breaking down the barriers that are caused by the symptoms of ADD. The opposing view is that doctors don't have enough interaction with patients to correctly administer these drugs. In the MTA study, doctors' only worry during the first month of treatment was to find the optimal dosage and medicine needed for each patient. This is something, and after that, each subsequent month, they met with the patient and parent for 30 minutes to make sure everything was going well, and they also had contact with the teachers to make sure things were going well in the classroom. In the real world, things aren't so closely monitored. Drugs are usually administered in smaller doses, fewer times a day, and patients don't see the doctor nearly as much. In Missouri, it's only required that patients on stimulants see their doctor for a checkup 4 times a year, leaving a 3-month gap in between these visits. This makes it very difficult to find the correct dosage or even the correct drug for each patient that will work optimally for them. In my opinion, you should follow the advice given to my mom by our pediatrician. Stimulants should be used in kids before they come to expect that they can't succeed academically with their condition. And they should be monitored closely while on the drugs and taken off of them as soon as they're old enough to manage their symptoms on their own. There will always be questions as to whether the effectiveness of the drugs outweighs the lack of oversight that often comes along with them. Questions like, is my child's potential academic success worth the risk that my doctor might miss some important symptom from lack of doctor visits? While I can't give a solid answer to that question, I can say that my brother's academic success was definitely worth the risk. He's now a Mizzou graduate and a productive member of society, and I think much of that can be attributed to the confidence he gained while on stimulants to treat his ADD. Thank you.